Well, in 20 words or less, can you tell us, or can you impart upon us your own ideas or solutions for how to address this primary care shortage situation?
20 words or less. Sure. No problem. I can't speak for the other branches of medicine. All I can speak to you about is the part I know, the field I know, which is primary care as a practicing internist and pediatrician. Somebody who's been board certified in both fields for at least 16 years, somebody who's been practicing really medicine for 20, 25 years and seen the changes. All I can tell you is it's time for the country to realize the importance of primary care preventive medicine and to create incentives for new doctors who are coming out of training to enter this field. And that does not include not reimbursing doctors for providing preventive services at a level that's adequate for them to support their livelihood and to support their medical offices. It does not include creating incentives for patients to see a specialist on a whim. It does not include incentives for medical insurance companies to compensate specialists at a level that is 3 to 10 times the compensation rate for a preventive care practitioner. And it certainly does not include the lack of reimbursement at the private third-party medical insurance level for providing general preventive services, and the delay in reimbursements that occur now for a doctor to really see patients in a preventive way. Because this system that we have now has forced us to see patients in such a short period of time and to see so many patients in a day that it's very difficult for us to really practice medicine the way that we've been trained to practice, to actually listen to a patient. We only get 5 to 8 minutes to see a patient. A patient who comes in with 3 or 4 major medical problems, let's say diabetes, high blood pressure, asthma, and heart disease, how can you discuss these things in 8 minutes? How can you discuss somebody who's been to war and come back with post-traumatic stress and all the things that they've seen and experienced, and they're having trouble adjusting to their life in a civilian way? How can you discuss this thing with them in 5 minutes and then just dismiss them, say, I'm sorry, I have no more time, I have to leave? It's criminal. So in short, I guess what I would suggest is that there be a reorientation of incentives and reimbursements for doctors to really reward primary care practitioners to provide the services they need in a timely and efficient way. And that means paying them more and allowing us more time to see our patients the way that we think that they should be seen. Not spending 8 to 10 minutes with a patient, but spending maybe 20 minutes. Spending 30 minutes to do a physical. Maybe instead of seeing 40 patients a day, which we have to do currently just to maintain our overhead, seeing maybe half that many patients in a day, but spending more time with them, finding out what their problems are and preventing those problems from getting worse, and saving more money down the road. Now,
But of course, it's a catch-22 situation, because if the current number of primary care doctors are allowed to see less patients, then there are even less opportunities for patients to see primary care doctors than exist now.
that's true. That's absolutely true. And I think that the answer for that is going to be time. But in order to create that new army of primary care doctors, you have to create the incentives for doctors who are in training currently to want to go into primary care. Because if we do nothing right now, if the system remains the way it is, we are going to be facing shortages for the foreseeable future, because residents, like any human being, don't want to go into a profession that's going to overwork them, undercompensate them, and burn them out very quickly. They're going to want to go into the field of medicine that they find not just rewarding for them, but also in a lifestyle kind of way, allows them to enjoy and participate in the things in life that the ordinary person would want to do. Have a family, enjoy themselves, be with their family, and raise their kids, or do other things if they have other interests. Write a book, or make a movie, or even make a YouTube video. I don't know, but doctors are like any other person. We enjoy what we do, but we don't necessarily go into the profession seeking to really not have a life. People do look forward to getting married, having children, and doing other things. Doctors do have other interests as well, and like anybody else, a doctor would like to be in a practice that allows them time to do other things. Otherwise, they'll just burn out and they'll just leave and do something else. Doctors as a whole, and primary care practitioners as a whole, like most other doctors, are very skilled and highly educated and could easily do other things that would generate more income. But we choose to go into this profession because this is what we like to do. However, if the current system remains the way it is, if the disincentives remain intact, if the reward system that currently exists is allowed to remain in place, and that is to reward specialists or to reward procedure-oriented medical care, and not to focus on preventive services or not to focus on primary care services, then yes, I don't see the shortage getting any better. I see it getting worse. I see it getting much worse.
Maybe I'll ask you